All right. Hi, everyone. Thank you for joining us. This is our third webinar. And I'm really excited today because we are joined by a friend that I've had now for over 20 years. We met on the glorious campus of Florida A&M University. And Thandi has been an amazing person, human, friend, sister, prayer partner, the bulk of my life, and thought it would be really great for us to have a conversation with her about her most recent journey, where she has turned her pain into advocacy. And I'm just really excited to have her here today. So, for those of you who are joining us for the first time, we like engagement. I appreciate that some people are on camera. Feel free to put comments in the chat. We will have a Q&A session towards the end. And but we look forward to just hearing from you all and getting your feedback. Dr. Monique Gary will be joining us in about 15 minutes. She is dealing with patients right now, as we, love her to do best. And so she will be joining us for the latter portion of today. So first, I want to turn it over to you, Thandi. It is Breast Cancer Awareness Month. And I want you to tell everybody your story. How did you get here? And why is this month so important and busy for you?
Yes. Well, thank you so much, first of all, Tamia, for this platform and for using your platform to advocate for women's health. I really appreciate that. And I would say, to be honest, before 2021, Tamia, Breast Cancer Awareness Month was just a month for me to check the box, check the girls, and say, okay, I'm good. Things changed. There was a plot twist in 2021. November 1st, 2021, I was diagnosed with breast cancer at 38 years young. And you've been there with me every step of the way. So I really appreciate that. And so I would say, how did I get here? How did I get here? I found my own lump in that's
Mhm.
August of 2021. And so I would say self-advocacy and making sure that you stay in tune with your body is so important because I had just had a well woman's checkup, nothing was there. And so I did my self-exam myself and I found a little friend that hadn't been there before and it was the size of a pea. And so I wanted to ignore the warning signs to Mia, but then I remembered that early detection saves lives. And for those who are listening, ignoring cancer does not make it magically disappear. It just makes it worse.
Mm.
And so it's so important that even though you may be scared, even though you may be, you don't know, it's important. If you see something, feel something, you need to say something. And I'm so glad that I was able to do that because now, 4 years later, after being diagnosed and going through a year of tests and a lot of things, 16 rounds of chemo, 30 days of radiation, and 4 surgeries, I'm still here now. And now I'm advocating and I'm dedicating my entire life and career to help those who are in need.
Oh, that's such a great story. And just seeing you from then to here is so beautiful. I think one of the things that you said, and you said this in the interview, and I don't think I ever asked you about this when you were going through this on your journey, but you said it was only the size of a pea. And I think in my mind, I've always thought when a woman felt a lump, it was like something really big. And I never even imagined that it could be something so tiny that can make such an impact. And that really sheds a light on how you can't ignore anything. The fact that you didn't ignore that is
Exactly.
huge.
Exactly. And something else to me, it's not always a lump. It can be a discharge. It can be a
Mm.
there's so many. The lump is the one that most people focus on, but that's not the only side effect. And so I want to make sure that your listeners know that as well. It could be leaking, again, it could be dimples, it could be anything, itching. So if something is not right with the girls, again, make sure that you pay attention because our bodies are always speaking, but oftentimes we ignore the warning signs.
Yeah, you're so right about that. And even when you said you did your own, I was like, ooh, sometimes I would just be like, you know, they're small. We can keep it moving. And like finding out, which we've talked about, and I know Dr. Gary will talk with us about too, is like the importance when even if they're small, they can still be dense and how mine are. And how I had my first mammogram at 40 and they were like, you got to come back because we can't see. We need you to do an ultrasound. And just like knowing, and they were saying to me like, this is normal when you have dense breast, but you need to make sure that you get the second look at it because we can't quite tell. And I think that's something that we have found that like a lot of Black women have too, right? And so I didn't know if you had any thoughts on that too, but that's definitely something for me. I was like, okay, I need to be better about my preventive care.
Absolutely. And you are spot on to me when it comes to especially women of color, because I have dense breasts. And so they was like, well, you just have dense breasts, come back. If someone tells you just to come back, or wait until you're 40, advocate for yourself and say, may I please get a second opinion? Because I think about, to me, if I would have waited from 38 to 40 just to get a mammogram, my life would be completely different right now. And so it's so important that you ask the right questions, that you speak up, that you advocate for yourself, you get the second opinion because, again, the guidelines are you have to wait until you're 40. But it's
Hmm.
so, again, I was 38. They're getting
38.
younger. I met a 22-year-old the other day who has breast cancer. So it's so important that you advocate for yourself.
Whew, yeah, I'm really glad that you say that and stress the importance of it because it doesn't it doesn't matter the age. Like you said, when I was at Essence with Dr. Gary, I met survivors that were like 19 and just something I would have never thought about, you know? And it's just I think it's really real about how when something either personally affects you, you start to pay attention a little more, and how it's important now that we have to take care of ourselves always. And we tend to, as women of color, are busy, put ourselves before everyone else. And you have children too. So it really is about that mask on mentality of like, let me take care of me because I can't take care of everyone else if I'm not taking care of my own self.
Absolutely. And I'm so glad that you said that to Mia because you're right. We're all juggling. We all have many hats, but it's so important that we take care of our bodies because everything else can wait, right? And so if we don't take care of ourselves, then how can we take care of our family, right? So I'm
Right.
glad that I was able to take off that superwoman cape and say, right now, I need to focus on my health. It's not about
Right.
presentation, at work. It's not about being in the boardroom. It's not about being this mother, but how can I take care of me so that I can be better for everyone else? And I'm so
Hmm.
pause and prioritize my health above everything else.
Amen to that. Did I see Dr. Gary join us? I see the white coat.
Hey there.
Anaya, hey, Anaya, are you able to spotlight her too? There she
I
is.
love this. Listen, I'm loving this conversation because if there were ever a time to prioritize yourself and your well-being, it is this moment right here. And I think that, it bleeds over into every other area of life because it can feel, oh, preventive care feels overwhelming. At least to me it
Mhm.
does, because I'm busy, right? And I got to find a way to go downstairs and get the mammogram. I got to get it scheduled. And I was trying to schedule mine, and they said, "Well, we are booked until January." I was like, but okay, so what am I supposed, but I'm due, and
Yeah.
then you've got dense breast. So now you got to get a second thing. And if you didn't know, if your doctor didn't order that thing, now you got to go back and talk to your doctor and you got to get a second thing done. And you got to schedule that. You got to take another day. And so it can feel really overwhelming, at least to me, to try to wrap my mind around all the things I need to do just to stay healthy. But I have to double down on that commitment to myself because one, if I don't, I'm no good to anybody else, right? Like health is
Mhm,
wealth. And
mhm.
two, I think this current social political climate really confirms the fact that we need to prioritize our mental and physical wellness. That we don't time for that. We're going to be forced to take time for it later on. So, while it's not always an easy thing to do, there's some things that we can remember and we can ask about and some tips to,
Mhm.
kind of take to our doctors to try to get everything you need in this as short a time period as possible. But we have to find those spaces and we have to hold each other accountable, just like we do for other things. And we show up at our churches and on our ministries and in our work and our community service and our sororities and our links chapters and all the things that we do. We have to really double down on that commitment and maybe be accountable to and for each other for it.
I'm really glad that you said that I don't know if you heard the part when we were talking about how we both have dense breasts and how it's important to do that second piece. And I feel like you and so I also want you to, talk about your story too, Dr. Gary. For those of you who don't know, I'm very blessed to have her as my family. She's my cousin. And one of the great things about that I know is at holidays, it's blood pressure checks. It's, did you get your mammogram, Tamia? When was the last time you've been to the doctor? How's your stomach doing? But that is so important, right? And to have someone remind you of those things, and I don't want to look at you in the face and be like, "Ooh, girl, I didn't do it." And it's important to have that. And the time it is, that is the biggest piece. And all three of us live busy lives, and you all know, for me, particularly in an election year, I take care of myself far less than I usually do. And I've been trying to be better about that because I'm getting older now, and I can't just, skate on by without seeing a doctor the whole year, and I can't keep kicking these appointments down the road. So I'm really glad to hear you say that. But also, just for you, Dr. Gary, I would love for you to tell our viewers who don't know you a bit about yourself and what you do and what you've seen. And like, why is this month so important? It's not just wearing the pink ribbon, but what does it really mean for those of us who don't know?
Very true, and thank you. Thanks for the invitation and the opportunity to be here. I love that that you're doing this and that you're doing it this month. But I'm Monique. I'm a breast surgeon, so a breast surgical oncologist, and I'm a breast cancer surgeon in Pennsylvania in Bucks County, which is about an hour outside of Philadelphia. Proud graduate of Florida A&M University, along with these two beautiful, lovely individuals here. The Rattlers are in the house, and
Yeah.
what else do I do? I am an associate professor at Dartmouth Geisel School of Medicine and the chief medical officer for BEXA, a company that looks at solutions for early detection that can come to the workplace. So ask me about BEXA if you are in a place that has more than 100 employees and you need a wellness benefit. We can bring some breast exams to you. But I
Mm,
do this work for my grandmother who was diagnosed with breast cancer when I was young, and I didn't understand all of it then. I knew my mother had died of something, some type of cancer. Nobody liked to talk about it. And this is what's
mm.
deep, to me, because I don't think I learned till I was almost 29 what my
Wow.
mother died from when she was 29
When she was 29.
because we didn't like to talk about it. It was a terrible thing that happened in the family, and so people didn't bring it up. But she had ovarian cancer, which is a very rare type of cancer, ovarian cancer. Less than 1% of the population has ovarian cancer. But we're seeing, more and more of that. And she was young, and I probably should have got genetic testing and started screening. And then my grandmother got a type of breast cancer called invasive lobular carcinoma that can show up in both breasts. And it started in one breast, and then, she had a mastectomy and some lymph nodes removed. I believe she was stage 2. And a few years later, it happened in the other breast. And each time some doctor told her she probably had 6 months to live. And she was like, I have these grandkids I'm taking care of, and I really don't have time to die. So, what else can we do here? Like, what are our options? And she taught me through that example. I look back now of how to advocate for yourself.
Mm,
So that's why I do what I do. And I love the fact that I get to participate in conversations like this. I sit on the medical advisory board for, Living Beyond Breast Cancer, Touch the Black Breast Cancer Alliance, Tiger Lily Foundation, oh gosh, who else? Breastcancer.org, you name it. And I've tried to be the doctor who shows up to be a voice of trust and of reason and of good information, because there's a lot of mis and disinformation out there, and there's a lot of medical mistrust that is earned. It's deserved. When you hear young people say, you know what, I got turned away, my doctor said it's probably nothing, and then 6 months later they're metastatic, like there's a disconnect.
mm,
So I really try to be that bridge to make sure I'm giving good information, that I am listening and building trust with communities. And I guess the last thing is I have a farm here in PA. It's 40 acres for integrative wellness. And, we started out for cancer patients, but everybody wants to learn about integrative wellness and how it can help us in our wellness journey, not just in sickness. So that's what we
mm,
do, what we teach. And we have executive retreats. We have groups that come out. We've got summer camps. Camp Jill Scott comes every year. And it's a wonderful place to learn about different aspects of wellness to see what fits and feels right for you. So I'm grateful to be here and to participate in the discussion. Put your questions in the chat. I will be monitoring
mm.
the chat during the conversation, and we want to make sure that we get to the issues and the questions that you have.
I appreciate that. And we love our retreats at your space. Um, Thandi, Dr. Gary talked about wellness, and you are literally one of the healthiest people I've ever known. Always worked out, always ate well. Talk about your wellness journey in this process, even prior to, but also in survivorship. What does that look like for you? How that change for you?
Yeah, and I want to give you a really quick stat. 30% of breast cancer diagnoses are caused by modifiable risk factors, right? And so oftentimes when we think about breast cancer, we feel as though we don't have control, but we do have control over what we eat, how we move, and all of that, right? And so even before 2021, as you mentioned, when you met me in college, I was doing Tae and I was exercising
Yes.
these, right? And so I've always been on this healthy track. I
Billy
thought
Blank.
I had
Billy Blanks.
exactly. I thought that I had checked the box to stay cancer free. When I tell you, I went through all the research. Okay, breastfeed your kids. Okay, check. Eat healthy. Okay, check. So I did everything that I thought. And so I think that's why I was kind of blindsided, in 2021. But that's something else to remember. Breast cancer does not have to run in your family for you to get it. And so I just want people to understand that, yes, continue to exercise, continue to eat healthy. And so not only before the journey, but during the journey, I ask questions to my doctor. So instead of just doing the conventional treatment, the surgery, chemo and radiation, I say, well, what type of integrative, treatment is available? And so she told me that I can do acupuncture, I can do psychotherapy, massage therapy. I had a nutritionist, I had someone helping me to work out when I could, because that is so important. And I know, Dr. Gary, you've done a lot of research on the impact of exercise and recovery, and so
Mm,
it's so important that we take what we can in control, right? So when you're going through your journey, losing the hair, losing the boobs, you feel as though you're out of control completely. But what I had to do was say, okay, yes, this is tough, but what can I control? And so I would control how I would eat. And so making juices and the kale and the salmon. And she said, Thandi, I want you to do chemo. I want you to fight fire with fire, but I want you to grab your salmon and your kale and your smoothie so that you can also heal internally. And so I'll never forget that conversation that we had prior to having that first infusion. She said, do your part. And ever since then, I've been doing it.
I love that. And I love how you had both. And Dr. Gary, you and I have talked about this too, how you need both, right? Can you also talk about that just from the clinical perspective of the importance of taking care of yourself, both through treatment and then your own health?
Absolutely, and I think that it's the one thing that you actually do have a little bit of control over. Just like Tanya said, so much of it feels out of your control. I boil it down to just three M's: the meals, movement, and mindset is all we've got in this world of
Mm,
control, right? What we put in and on our bodies, how well we're resting, how we're managing our stress, how we're moving our bodies in whatever ways we can, and then the foods that we're eating and the products that we're using. So those are the things. But it is very important, I think, one, for doctors to acknowledge that this is an important component of your cancer journey and of your wellness journey, because so much of, you get diagnosed. Patients ask me, am I going to die? Do I need chemo? And how can I do this holistically? And that third question, a lot of doctors sit there and they're like, well, read the labels and, calorie count. You're like, yeah, but what food should I eat? Well, whatever you can get down, whatever you can stomach.
mm,
No, no, there
that's
is more.
awful.
There is a science to it. There's a whole society devoted to integrative oncology. It's the Society of Integrative Oncology that talks about the foods that can help fight cancer. So briefly, I recommend foods, high in antioxidants, right? They are the Pac-Mans that chomp away at damaged cells. And all of cancer treatment, and Tiny can talk about this, it makes you tired, right? Everything these white coats do makes you exhausted. And so putting in foods that give you more energy, more protein, whether it's in bone broth, whether it's in pea protein and vegetarian, vegan protein, whatever form, more protein, more dark green leafy vegetables, chromium, zinc, selenium, all that stuff. And if you have a cancer journey, it will help. If you don't, it will help your body to be able to regenerate those cells. So there's definitely some foods that we should be looking at. And it's really the eating the rainbow that helps us
Mhm,
to make sure that we can optimize our bodies for wellness. Because like Tiny mentioned, it's modifiable risk factors, but people who do all the things, it still can happen. And so the best that we can do is to optimize our bodies to manage whatever life throws at it, whether it's a recession, whether it's, government shutdown, whether it's cancer, whether it's just, autoimmune disease, lupus, PCOS. Everybody's got something. Things happen.
mhm.
But how do you optimize your body for wellness is something that goes across all disciplines of wellness.
Appreciate that so much. Um, I remarked earlier about having community. You are a big part of, both of you are part of my community. Dr. Gary slash Monique to us. You're a big part of my community in making sure I stay healthy. Thandi, what did that look for like for you? How did community play a role in your journey?
What's your name?
I tell everyone no one should fight this battle alone because it is not a solo battle. You need a village. You need those who are around you to hold you up. And like I mentioned earlier, I took off my Superwoman cape. Usually I'm the one that's strong for everybody. I said, no, this is the time where I need you all to gather around me. So my community included family, friends, my coworkers. Really quick shout out to Stacy. She's on the call as well. She is an amazing, amazing person, amazing, amazing human being. She's a stage four thriver. She's also a part of my community. But I just want to say it is so important. And I remember, Tamia, when I got the call that we had a Zoom call with two other friends, and you had on your shirt, you had a pink shirt on that day, and you said it had "She Will Rise." That's what your shirt
Yep.
on the day that I was diagnosed when we had the Zoom call. And so having that community, having the affirmations, having the positivity around you is so important so that you can continue to fight. They don't call it a fight for nothing. It is a fight. It affects you mentally, physically, emotionally, financially. And so you need those people who will surround you and help you in those times of when your energy is low, when you need someone to pick up the kids, when you need someone to make a meal. It's so important that you ask for help and not
Mm.
get bad about it.
I remember that. And I did not know what you were going to tell us when I had that shirt, and I've kept it.
Yeah.
Just, it always makes me think of you. So I want to transition a little bit in talking about health disparities and how women of color are really impacted in a way. I know, Dr. Gary, you and I have talked a lot about how it needs to even be lower than 40 for women of color. Can you talk about disparities and how health disparities impact women with who get breast cancer, and what does it look like to have real culturally competent care?
Ooh, good question. And people like to say, "Oh, cancer doesn't discriminate," and it does in the sense that the outcomes, right? How well people are living, how long they're living. It discriminates at the level of the doctors who offer different treatments to different people. It discriminate cancers that we are more likely to get. And so there are some differences in our experience of breast cancer. Not to recite statistics that I think people have heard before, but Black and brown women are more likely to get aggressive types of cancers called triple negative breast cancer, right? We are
Mhm.
diagnosed at a younger age and a later stage. And so that means that we need to start educating our young ladies about their breast health so that they know what to look out for because they're too young for conventional screening. And so there's a disparity at the screening, right? And then once you get diagnosed,
Uh-oh. Is she cutting out for you?
Mhm.
You're cutting out a little bit.
so being
Yeah.
diagnosed at a later stage means you may have more fewer reconstructive options, right? Because you got to get chemo, you got to get radiation. You may not be eligible for the direct implants and all the hidden scars and keeping your nipples and all those sorts of wonderful things. And so there's disparities in the treatment that even doctors are offering, right? The studies
Mhm.
show that Black women are less likely to undergo more aggressive therapies unless their doctors sit down and I'm going to go back on camera and talk to them at eye level. And just sitting down and talking at eye level can increase the rate of you doing a more aggressive therapy that could save your life, right? And if we don't do that, then we're going to say, well, we offered a clinical trial. She didn't take it. Or we offered that chemo. Yeah, but did we really talk about how life-saving it was going to be? Or did we just say, you need chemo, ma'am? Here's your papers and see you later.
Mm.
And so the elements of really meeting people where they are and then asking them, what do you believe? What's important to you? Right? Culturally. Okay, you need to talk to your pastor. You need to pray about this. Well, who's your circle? Who are your people?
Right.
Who do we need to call? And those conversations don't always happen. It's, the chart and the tumor and the person second. And so one of the things we try to do at Dartmouth, and Tiny's been really great as an instructor and a visiting professor, is to teach it's the person first, the patient, the person, then the tumor and the chart and everything else. But attached to that is an entire ecosystem. There's a whole universe that needs to be addressed before we can even get to the cancer part. So there are elements that culturally we are not as in tune or as sensitive to, and it results in more disparities. less likely to complete therapies like radiation because of the
Mm,
cost, right? You're trying to figure out, and you may have comorbidities, diabetes, you're on insulin. You're trying to juggle all of those things. You might be a primary caregiver and a breadwinner, right? And you got a kid in college and you're trying to figure out, how do I manage things? So we barter and bargain with our health. And so there's a disparity there at the treatment level, and they want to say she's non-compliant. Well, it's not that she's non-compliant, it's that she's got to keep this light bill on, and she's got a kid in college who needs a tuition paid. And so she had to barter, she had to bargain. She couldn't afford that prescription this month. So financial navigation is another area of disparity. So
mm,
we really have to kind of dive into those things. And I think it's so important for those questions and to not just assume that a person can or won't, that they don't have the means, or that they do have the means. It's, treat you how you need to be treated and not making those assumptions. But there's a lot of bias that contributes to the disparities in outcome. And the last thing is the clinical trials and the research,
I was gonna say
right?
that.
Black and
Hmm.
brown women make up less than less than 3% of clinical research. And if we don't show up, we're going to get what we've always gotten, which is the more toxic therapies. And we are in the era of precision medicine, precision oncology. And the only way to target and make it precise is to have the genome to make it targeted and precise too. And so we need that participation so that we can have more targeted therapies, less toxicities, and overall better outcomes. So disparities from all across the spectrum that contribute to what looks so different between Black and white women.
Mm. I have so many questions after that before I go. Thandi, do you want to comment on that at all?
His perspective, and Dr. Gary hit it on the head. The disparity, I always tell people I had two battles to fight: the disease and the disparity in the healthcare system. And even as an educated Black woman, every time I went to the doctor, I had to stay two steps ahead to me. I had
Mm,
to do my research, I had to ask questions, I had to get a second opinion, because you're right, you are judged. You are judged. And so I would go to every appointment, I would dress up, I would take a family member so they would know that I was loved and cared for. And so
mm,
I introduced myself. I said, "Hi, I'm Thandi Montgomery. I am a strategist. I will ask questions, not because I doubt what you're saying, but we're going to be in this together." And so I had to gain respect from day one, because if not, they just look at you and say, "Oh, okay, well, she's just a young African American female. We'll just diagnose her. We'll give her the treatment, and that's it." But if anyone is listening, I want you to understand that it's so important that you advocate for yourself. I'm going to keep saying that. It's a broken record. But when I went in there, I was very specific, because a lot of times, again, doctors just think that, okay, we can just do whatever. It's just another patient. And I always tell people that with the doctors, this may be your 500th time saying the diagnosis, but this is my first time hearing it. So please make sure your bedside manners are good, right?
mm.
Most of my doctors, I call them my MVPs, my most valuable physicians. And so it's so important that you build that rapport, you ask those questions. If something doesn't make sense, you ask why. Now, some
Mhm,
doctors, to me, will get offended by that. And
mhm,
experienced that as well. And I didn't know this could happen, but I received a termination letter from one of my doctors because I was asking for the integrative side versus, the surgery and the treatment. And so I just want people to understand that it's still happening in 2025. There's still discrimination. And it was hard enough to go through that journey, but to receive that termination letter, it was very difficult, very, very difficult. So it's still happening in 2025.
yeah, I did not even realize that was a thing when you and I were talking about it. Dr. Gary, you have thoughts on that? Because I'm still baffled when she and I talked about it before.
You know, I, it is, I think I've had to terminate one or two patients in my career, and usually it's because they're disruptive and cursing at my staff.
Oh, yeah.
Because you don't take that from anybody, right? Not whether a patient or your personal street. But I think for a doctor to be that insecure that you could not tolerate or you could not understand how a person could have questions, and understand that even sometimes in the delivery of those questions, it may seem defensive. Right? It's gonna see me. It's not like, oh, there's a Black doctor. Yes, I say the word chemotherapy, arms do this. And, whether they're out here in rural Pennsylvania or, in inner city, people don't trust doctors for a lot of different reasons. And they think there's a cure out there and that
Uh-oh, hold on. Anaya, can you check and maybe somebody's not muted? Because it's causing some background noise.
and that's the responsibility. And so I don't take offense to questions. I actually want my patients to ask me questions because I want to know what you're reading. I want to know what you
Mm-hmm.
think. I want to know, what did you see on TikTok and what are you about to leave here and go do so we can talk about these things. Right.
TikTok.
And so there's a way to do that makes it approachable and that helps that doctor to remember that we're on the same team. And that this might be, like Thandi said, it might be our 100th time saying it, but it's their first time hearing it, and they have the right to ask questions. They have the right to participate in their care. So I think it's really unfortunate. Right? We need to talk about repair in relationships. We know what harm feels like, but we don't always know what a good relationship looks like and feels like, and how to foster that for another day, because you may be feeling misunderstood. Some questions you can ask your doctor that will jolt them right back into, what would you do if I were your loved
Mhm.
one? Or if
Mm.
this for you, is that really what you said? Because this is on my side. And to ask some of those questions can sometimes build the trust in a relationship. It's not always that easy, especially if there's only one, or if you if you're just captivated.
Mhm.
The tail end of you cut out. Are you back? It's like a delay. Can you turn your camera off? Because we don't want to miss what you're saying.
No problem. What
There
I
we
said
go.
was, you can't always fire your doctor, right? Then people are quick to say fire your doctor, but sometimes you live rural and there's only one. Sometimes you're
Mm-hmm.
capitated to a system, right? It's a hardship for you to get months to get a second opinion. And so sometimes a relationship can be repaired. And I think that we need to look at what those relationships with our doctors look like because of our inherent mistrust. And there's some things we can do to start to repair that relationship too. And I think Tani did those things, right? She goes in with an open mind and says, okay, doc, we're on the team here. You part of my team, and I want to be a participant in this. And if a doctor can't get with that, hit the bricks.
Mhm.
I love
I
that.
and something else to me, I would say for the listeners is know your rights. Sometimes
Mm.
you go into the doctor's appointment and they're rushing. They give you 5 minutes. They're in and out. Based on insurance, you have 15 minutes with your doctor. And so I had to let my doctor know it was another doctor. She was rushing in and out. I said, well, listen, I have 15 minutes based on my insurance.
I know that's right.
Questions that I need to ask. And so it's so important that we empower each other. We know our rights, and we go in again. It's more of a partnership. It's not you versus me. It's a partnership. And so how do we sit down? How do we have the conversations? I understand that you have 100 more patients, but right now I need my 15 minutes. I need us to have this conversation. I need us to make sure that we're in lockstep because this is my health you're talking about. It's not just a bump on my hand. This is cancer. This is
Hmm.
cancer, right? You're talking about radiology, you're talking about chemotherapy. I need to understand the options. And so it's so important that we advocate for ourselves again, and you know your rights when you go into the doctor's office.
That's so important. I feel like you're the model patient. Like you knew your rights, you did your research, you stood up for yourself. And it's a good reminder just in general with your healthcare to be able to know those things about yourself. Because I think sometimes we go in there and we're just kind of like I get as outspoken as both of you know I am. I'll get in there and I get kind of nervous, and then I'm like, oh, I didn't ask the questions I wanted to ask, and then it's 6 months till my next appointment.
Mhm.
So having that reminder that in the way that I deal with people in an opposing party and deal with stuff in the workplace, I need to be the same way when it comes to my health.
Mhm.
It's hard though, because you don't always know what to ask and you don't feel empowered when you're sitting there with your boobs out or your butt out or whatever it is, in those rooms, in those spaces. It's not like you studied and trained in these things, right? So you don't really know what to ask. And the doctor's like, all right, well, it's probably this, this, and this. And you're like, okay, well, I guess that's what it is then,
Hmm. Hmm.
But what should I look for at home? What asking questions like, how can we be more sure? Is there any other imaging that we should do? Things like
Hmm.
that,
Hmm.
what is there any other workup that we should do, Doc? When should I come back to you? Okay, so when we gonna close the loop on this, right? Like those are things that we can ask to sort of get a little bit deeper in our understanding of what's going on with us so that we can make sure that we get our questions answered. And then having questions ahead of time is always, always a good thing. And if you can bring somebody with you, bringing someone with you or having somebody on the phone, I'm quick to say, who's important to you? Anybody we need to include in this conversation?
Mm. Hmm.
Because then that person they're removed from it. They can ask the question, oh, wait, Doc, I remember, here it is, number 5 on the list. We didn't ask this one yet. And so those are important things to consider for any health condition. It's just if you have a new diagnosis of anything, bring somebody with you and have your pre-made question sheet with you.
That's so real. And when you said have someone on the phone, I think about my sister's on here. Anytime I deal with anything with my car, my dad's on the phone. I don't let them try to play it. We always have him on. It's like, oh, not even thinking about, okay, dealing with a car. Yeah, it's easy. I'll just call my dad. But with this, it's like you could have someone with you. You don't have to go through it by yourself. So I appreciate you all both highlighting the importance of community in this. I know we have a couple of questions in the chat. Before we get there, I want to ask two more things. One, Thandi, you started a business, a movement around this. And I want to give you a minute to, or however long you need, to talk about how this has motivated you. You traveling with Dr. Gary, y'all out here innovating, creating things. And I want everyone to hear more about what you're doing and how we can be supportive to you.
Thank you so much. So just to kind of back up, my background is in marketing. So I spent 15 years as a marketing executive in advertising. And after my journey, I was like, no, I can't go back to that. I can't just go back to working for, some of these really big Fortune 500 companies. I said, I didn't fight to survive to go back to that. And so, but what I did was I used my skills and talents in marketing and speaking and coaching and consulting, and I created the Thandi Monet brand. And to me, I remember sitting in the infusion chair, working
Mm.
on my logo, working on my business plan, because I realized that, yes, I'm going through this diagnosis, but this is not the end. And so that was a part of my purpose. That was a part of my creativity to help me get through the journey. And so I created the Thandi Monet brand, and ever since then, we're about 2 years old now. I'm so excited. We have been doing so much work in the community from, like I said, coaching and consulting, building programming, and partnering with cancer organizations to create courses to help cancer survivors and patients rebuild. Because oftentimes people think that once you're done with treatment, once you've rang the bell, that it's over. But the
Mhm.
survivorship phase is a whole different phase that no one really talks about. It's a lot of rebuilding, like, who am I now? And so that is my heart. And then also working with Dr. Gary on an amazing innovation called NIP. It is a revolutionized app that really focuses on holistic care, mind, movement, and meals. And it's helping survivors figure out, okay, here's an app. I don't have my navigation person all the time, but I do have this app. And so if I'm experiencing some issues, I can go to this app. It can give me, it's driven by AI and it's science backed. And it's a
Mhm.
really cool, amazing idea. So I'm really grateful to be able to partner with Dr. Gary on that as well. And then I'm also traveling. I speak and I share my story across the US. And I'm just grateful for this second chance. And again,
Mm.
I'm taking my power back because oftentimes you feel as though cancer takes everything from you. But I'm taking my power back and slowly rebuilding.
I love that so much. Dr. Gary, you have any comments on the innovative side of this? I have a
Uh,
thought, but I'm gonna wait first.
oh, okay. So sorry, what was the question? Because Tiny she covers so much of it, and the work that we do is so tied together. But is it what work are we doing?
Yes, if you wanted to say
Okay.
anything else about the work that you all are doing.
Yes. So there's a couple things that I think are important. The one thing is, being in medical education, right? Like there should be a generation of Dr. Mo's. Like why is there one? And I'm
Well,
on
good
every
one.
advisory board because I might have a problem saying no, which is a conversation for a different. Right, that we probably could talk about, but it's also teaching doctors how to do this, how to show up, how to unlearn the language and the vernacular so people can actually understand what it is that we're trying to say. And so I spend a lot of time focused on that, and I invite survivors to come with me. And so Tiny has certainly has been one of our visiting professors. But if there are other folks who want to participate in that work and do lectures and talk to medical students, that would be a wonderful thing to do. And we
Mhm.
could do it virtually even. We could have entire workshops for lupus and breast cancer and other things, diabetes. Like we need the lived experience
Uh-oh, we're losing you again.
All right. So I'm still talking. Can you hear me now?
Yes, we can.
Okay. So yes, I said we need patients of all kinds and all disease states and all conditions to show up and to teach these students how to be people, people first and doctors second,
Mm,
because they're intimately tied together. The work we're doing with NIP, I think, is going to be life changing because focusing on how the science behind the things that we know, right? If food is medicine, how can food be medicine? If there is healing that comes from, if there's a benefit that comes from exercise to reduce cancer recurrence, okay, who's getting that benefit? And who has a trainer? Who can afford these things? And how do we use a wearable, right? The average household income of a person who can afford a wearable device is $75,000. That's just for a Fitbit. So if you've got a condition where you want to focus on these things and you want to improve those numbers to even get you into a clinical trial, where do we start? And that's what NIP is taking on. It's really looking at how do we change behaviors, nipping away at it one at a time, the things that can help us to get back to a state of wellness, no matter what disease conditions we might have, right? No matter what your
mhm.
diagnosis, how do you get back to the best version of wellness for you? And how do we move the needle in a science-backed way that's not just, eat sea moss and don't do chemo? Or, you know what, I'm just going to do whatever and I'm going to take the CMOS and I'm not going to take my metformin, right? No, we can do both, right? And maybe
Mhm.
metformin can be a bridge to wellness, right? Maybe our antihypertensives, while we're yet working on our diet and our sleep and our movement, right? Medicine can be a bridge. And so looking at the science behind those things is kind of one of the things that I wanted to do because one of the reasons we don't get invited to clinical trials is because we may have comorbidities that keep us from getting into those trials. So if we can optimize ourselves for wellness a little bit better, then maybe we can show up in these spaces and have a greater impact. So I'll stop talking there, but that's what we're trying to do is put the science to the holistic and then bring it to people who need it the most. So we are always looking for volunteers, looking for researchers, looking for resources, right? We're bootstrapping it and trying to buy wearables for people who can't afford them. So if you're a coach or if you got some extra funds and you're flex spending or whatever, and you want to donate some Fitbits to some cancer patients, we would love that.
Oh, I
But
love
just
that.
keep in touch with us, follow us, on social media, and and more to come.
I love that so much. Speaking of Tanya, can you put your website in and
Yes.
any material? We'll make sure also I'll get stuff from you all that we can send around to everybody on here. Before we go into Q&A, what part of what I wanted this to be is a conversation about this survivorship and then also how we, as there's a lot of people here who work in politics and policy like me, how can we help with this movement, right? With these efforts to educate women of color on preventive care. What can we do to make a difference?
One thing I would say is knowing that breast cancer does not just fit neatly within October. There are 11 months, additional months of the year. And so I think just taking it beyond the month of October really helps with campaigns, with platforms like this, having conversations like this, Tamia. And then also when it comes to the guidelines, how do we change the guidelines? I know it takes a lot of
Mhm,
work and effort, but how do we decrease it from 40 to 35 or to
mhm,
30? That would be one thing. The
mhm,
second thing is when it comes to financial toxicities, I was at a gala this weekend and 75% of cancer patients worry about how they're going to pay for treatment and then how they're going to put food on the table and how they're going to pay the rent. And I don't believe any human being should ever have to worry about that. And so when it comes to the financial toxicities and the cost of cancer, it's so much money. It's hundreds and thousands of dollars for
mm,
chemo and radiation. So what happens to the uninsured? And
right.
when it comes to policies, how do we make sure that either the cost goes down or we get more help to pay for those expenses because treatment is very expensive. When I say very expensive, I mean very expensive.
Ooh.
And we think about, oftentimes we don't think about the uninsured or the underprivileged, but what
Mhm.
happens to them? They deserve the same exact right to survive that someone who has insurance does. And so if there's a way that we can change policy, again, with the guidelines and the age limit, as well as helping those who are uninsured and underprivileged, that would be amazing.
Yeah, and to piggyback off of that, let me turn my camera off so you can hear me. To piggyback off of that, I think that there's a couple things right now legislatively we need to look at, and it's
Mhm.
making sure that coverage for diagnostic imaging for dense breasts gets covered. I know we're going to talk about dense breasts in a second,
Yep.
but if you have to pay, if you have to pay for diagnostic imaging because your breasts are dense, well, 48% of the population, every second person pretty much has dense breasts. And if you still owe $1,300 on the ultrasound from last year, guess what? Chances are you aren't going to get it again this year, right? You're not
Right.
going to do it.
Right.
And so
Yeah.
looking at legislation that supports the, no cost sharing, right? HRSA has a
Mhm.
guideline, a recommendation for no cost sharing in 2026. Making sure that that is enacted and that people are adhering to that is going to be super important so that you don't have to pay out of pocket for the diagnostic, for the biopsy, for the pathology, and for the navigation.
Mm.
Because the navigation is what connects people to the resources, right? Like we have a financial navigator at my institution, but not everybody does. So how will you know where's the food? How will you know where the therapists are? How will you know where all these great resources, the yoga and acupuncture and all these wonderful things without a navigator? How do you know how to find a second opinion? So navigation is going to be no cost sharing too. 340B is prescription drugs, right? It's looking at what are
Mhm.
we doing for making sure that our drug plans are affordable for people who have chronic illnesses. So there's a whole push right now to look at this 340B program, and it's kind of controversial and it's not benefiting the people who need it the most. So I would say look into that and advocate that prescription drugs be covered at a discount for people who are under-resourced, right? And not just
Mhm.
geographically they're rural, because it's kind of shifting. That word under-resourced is becoming a buzzword no longer for inner city and black, but for rural and
Correct.
people who may have resources, but they don't live in the metropolitan areas. So there's this sort of sleight of hand thing that's happening right now
Mhm.
with the terminology and where the resources are being shifted to, even in the big, beautiful bill. So I would say pay attention to those things, look at the legislation for, our health and wellness and where those dollars are going, because,
Mhm.
like Thandi mentioned, even the screening age, right? The screening age at 40 for women at average risk. Well, how do you know if you're at average risk if nobody's ever done a risk assessment on you? So,
Right.
starting there, get that risk assessment, and hopefully we can get that screening age, especially for Black women, down to 35 at least, because we're getting diagnosed at a later stage and a younger age. So, I really do advocate for that. The Society of Breast Imaging as well does also recommend that Black women start earlier.
Mm. For the legislation that you mentioned, are all of those, they've all been drafted, so they're like sitting in the House or Senate? Do you know?
It's
So,
hard to it's hard to
political,
tell.
technical. Okay.
It's
I
hard
can
to
look it
tell.
up.
But I would love, we're gonna put together a fact sheet after this
Okay.
because some of it is state stuff, some of it is national
Mm-hmm.
stuff, and some
Mm-hmm.
of it is already in draft. So I think we should clarify that because people want to know what to advocate for to me, and they don't know whether to do it at the state level or at the
Right.
federal level. So let's dive into that deeper.
Yes, because I definitely want to know how I can be helpful here, but also on the state level. Okay, I appreciate both of you so much, and I I want to keep asking questions, but I see we have a lot here. Um, let's start. I think the first question I saw was about, all right, let's see, from Pam. Okay, I have grandkids that are of Hispanic heritage. Are they more likely to have dense breasts? And is that something as they move into late teens that we need to address in checkups? So maybe you should, I think there was a question about dense breasts, so maybe we should talk about that a little bit more, Dr. Gary, and then answer Pam's
Okay.
question.
Absolutely. So I put a link in the chat for breast density, densebreast.org. So understanding what breast density is, it is not the feeling. It's not when you go to the doctor and they go, you have dense breasts, right? Breast
Mm-hmm.
density is related to the amount of white stuff that shows up on your mammogram, the glandular density, the stuff that responds to hormones, the stuff that makes milk. When you're younger, you tend to have more of this, right? Because we're at an age, reproductive age. And so for the person who has granddaughters, yeah, the reason why mammograms start at 40 is not because cancer starts at 40. It's because of the breast density, right? So the under the age of 40, mammograms will have a higher miss rate because it's a density-based study. And so it's like looking at a cloudy sky looking for a snowball. And the younger you are, the cloudier your sky is. And so that's kind of one of the reasons why I'm involved in technologies that are density independent to try to find ways around that so we can look at screen younger women, pregnant women, lactating women. But the density is the white stuff. Every second person has dense breasts and it's categories. So your homework, your mission, should you all choose to accept it, is to learn your category of density. There are four: A, B, C, and D. Sometimes they'll say
Mm.
one, two, three, and four. And if you are category 3 or 4 or category C or D, that means you have dense breasts and you would benefit from supplemental imaging. You could use an ultrasound in addition to your mammogram, potentially an MRI, depending on your family history. So that's the deal with dense breasts. So to the person who said their granddaughters, chances are your granddaughters are young and they have dense breasts. Ethnically, there are some disparities. And if you look up, Black women and breast density, there are some studies showing Black women can have up to 30% higher breast density than white counterparts. Hispanic women may have some studies show they have a higher propensity and some studies show they have a lower propensity. So it has more to do with age, with BMI. So folks who have a higher body mass index may have more fatty tissue, which isn't a bad thing in the breast world. We can see through it. Shows up black on the screen. But you got to look, and it's only by mammogram can density be detected. So that's the most important thing. If somebody's feeling and assuming you have dense breasts, that's a feeling. That's not a category of density.
Wow. Okay. And I saw Sharon had a question similar about 3D, how have imaging technologies like 3D mammography, good Lord, or contrast enhanced mammography improve detection rates?
Oh, I love this question. So 3D mammogram. So the old mammograms were like console TVs. Remember those?
Yeah. Yes, me and my sister saw a picture of one of those yesterday in an apartment she was looking at. We're like, why is that still there?
Exactly, right? My grandmother had one. And when it broke, she put another one on top and it became furniture, right? So the old mammograms, the 2D mammograms are like that. And the static on the screen is the density. So that's a good way to think about your density. The more static on the screen, the harder it is to see the picture. Now, the new mammograms are like flat screen TVs, right? It's a much clearer picture. And 3D mammograms give us slices through the breast. So it's like a flip book, forwards and backwards, up and down. So we can see layer by layer by layer if there's something in that breast. And so the clarity, the picture clarity of a 2D versus a 3D is so, so much better that I'm going to have to pull up a
Mm,
PowerPoint here and I'm going to have to show you the difference. So if you give me 1 second, I'm going to pull that up. But I want you to be able to see exactly what I mean when I talk about breast density. Hang on 1 second because I
I
got a
love it. I'm
slide.
a visual learner, so I love a visual.
All right, boom, here we go. Let's see. Let me go back to the Zoom. I'm going to share my screen. I'm not going to, oh,
You
I'm
share
not,
it?
I need permission.
Okay, Anaya, can you give Dr. Gary permission?
All right, here we go. So let me share this real quick. All right, so here we go. Breast density. This is the first thing, right? Can you all see this? The categories of density.
Mm-hmm.
Are you looking at, so category 1 is fat, it's not an insult. Category 2 means there's some snow on the screen. Category 3 is getting harder to see. Category 4, this is a snow cone. It's really hard to see a cancer or a mass. And 2D mammograms just show the density. 3D, look at this. You can see that there's something in here where
Mm,
you couldn't see before. And so this is the difference between 2D and 3D. So if you're having events at your church, things like that, they're sending out the mobile van. There should not be a 2D, there should be a 3D mobile unit because 3D is the more top of the line and it is more appropriate for people who have dense breasts because it helps us to tease through all of this and see what's really going on in the breast tissue. So that's the deal with the breast density and the 3D mammograms. Contrast enhanced mammograms are now an IV. So they put an IV in and they look at areas and they send the blood flow, the contrast through the breast and it looks to see these areas. So I stopped sharing my screen because I don't have a picture of that one on a PowerPoint. Um, it's not standard of care yet, and it is not for screening. It's not approved. It is for diagnostic imaging. The challenge with all of these is the issue of adoption, right? Nobody ever said, hey, you add contrast, I'm going to get my mammogram. Or, hey, you added
Mm.
AI, now I'm really going out and getting it. It's the fact that they don't want their boobs smashed and that it hurts and that it costs and they don't, So the problem of adoption, contrast doesn't solve for that. 3D doesn't solve for that. So it's a lot of education for us to get women to do it. And we keep trying to improve this technology and make it better, but we really need to improve the experience so that more women would actually go out and get it. And that's one of the things that we have to work towards, I think, is making the experience of early detection feel a little bit more like wellness and a lot less like I'm sitting here waiting to find out if I have cancer. People don't want to do that when they feel well, and that's why they put it off.
Mm, that's so real. Wow. Does anyone else, we're almost at time, although as for those of you who regularly attend our webinars, we almost always go over. But to be respectful of these ladies' time, does anyone else have any questions? You can either drop in the chat or you can turn your mic off.
I got one in the chat. Somebody put in the chat, what are the most promising developments in hormone therapy resistance or triple negative breast
Oh, I
cancer?
missed that.
Okay, I think it was a private chat, but
Okay.
it's an important question. And so you can hear me real quick. I'll turn the camera off again.
Hmm.
So, triple negative breast cancer sounds like it's a good thing because it's three negatives, but it actually means that we don't understand it fully the mechanism for how it works and what's driving it. It's not estrogen driven, right? Whereas some cancers, you can take a pill and block your estrogen. It's sort of like the difference to me between going through the toll booths on the PA Turnpike or being in the Easy Pass lane,
Okay.
right? That's how I
Yeah.
explain hormone receptors to cancer patients. So when you have these three stations on the cells, there's an estrogen receptor or toll booth for estrogen, there's one for progesterone, and there's another one for HER2, which is a different protein. When you don't have those, it's called triple negative, and it is akin to being in the easy pass lane because I can't give you a pill to block your estrogen. You're not using estrogen, you're not using dollars, right? So you're zooming on by. So
Mm,
those have been historically higher incidence in Black women, in younger women, in women who have the BRCA mutations. Now, the treatments for that have been historically chemotherapy, but there are so many new drugs on the horizon based on knowing the genetic testing. PARP inhibitors, for example. PARP, PARP inhibitors is a new development, promising. There are CDK4 and 6 inhibitors, and it's getting a little bit technical. But we're
mm,
learning that there are new targets on the cells for triple negative breast cancer that we need to lean into. And so the take home here is if you know somebody who has breast cancer and you know if they have triple negative breast cancer, ask about genomic testing, right? Testing my tumor because you want to
mm.
test your tumor to see if it has the markers for these different and targeted drugs. So that's kind of the take home here because I could go on and on about the different drugs, but for anybody newly diagnosed, ask about genomic testing, not just the ERPR and HER2. There's a whole slew of other tests. Biomarker testing is the other term for this because
I've
these are
heard you say
now
that.
determining what types of treatment people can get. And it's no longer just the full Monty heavy chemotherapy. There are immunotherapies as well, Keytruda and others that are approved for triple negative breast cancer. So more precision is coming, but the rate of women getting tested for the precision drugs, there's a disparity there. They are
Mm,
not offering all Black women testing and biomarker testing. So ask for it. That's the take home.
appreciate that. Before we wrap, we have one more question from our other Rattler sister, Jasmine McBride. Hi, Jazz. How accurate is genetic testing to identify markers of breast cancer?
Depends on the test. But hereditary testing tests the genes you were born with, mother, father, right? We get 50-50. And that doesn't tell us if you're going to get cancer, but it can predict the likelihood of it in your lifetime. So if you have family history, if there are three or more relatives with something, right? Breast
Mhm.
cancer, colon cancer, whatever. If someone was diagnosed young, under the age of 40 or 50, you might meet criteria for genetic testing. And that will tell you if you have mutations in the gatekeeper genes that are supposed to protect you from getting cancers. So knowing your family history is really important because you can also understand when to start screening wanted to put a question in the chat. At what age do you start screening for cancer? And everybody will say, oh, it's 40, oh, it's 45, oh, it's this, it's that. It's 10 years younger than the youngest person in your family.
Wow.
Mm. That's the age to start screening. And so if you don't know your
Wow.
history, you're not going to know when to start screening. You'll start at 40 or for colon 45 or for prostate, whatever, And so 10 years younger than the youngest person in your family is when you should start.
Mm.
You got to know the family history. And if you have young people in your family or multiple cancers in your family, you can check those genes and you can see what's your lifetime risk. And then at least you know how often to get screened and how to manage your wellness to modify or to reduce that risk as best as you can.
Wow. Okay. I took my notes.
I got
Um,
one
Go
more for
ahead,
everybody
please.
because this is a big one. We didn't talk about symptoms of breast cancer, but the number one symptom
Mm,
of breast cancer, the number one symptom of colon cancer, the number one symptom of prostate cancer, the number one symptom of cervical cancer
of course, she cuts out. What did you say it was?
is no symptom at all. The number one
Wow.
symptom for all of these cancers we screen for is no symptom. And is why screening is so important, right? Don't wait until you have a symptom if you are eligible, if you're of age for screening. If you're too young, that's different. Go to your doctor and don't take no for an answer. But if you're of the age of screening, get the screening because the number one symptom for these things is no symptom at all. And I'm not trying to scare people, but it's just to say that finding incidental stuff, find it early, get rid of it, right? Keep on living. But the symptoms for breast cancer, a breast mass, thickening of the skin, lumps under the arm, nipple discharge, all those sorts of things are somewhat later in nature. So keeping up with the
Mm,
preventive stuff as best as you can. And we all miss a year and we miss a month. And, life is really real, but do the best you can and ask your doctor, when should I be screened? And if you're over the age of 65, don't take no for an answer, right? Because they'll start to tell you, oh, you don't need those anymore. But I tell you, 40% of my patients I'm seeing, they're older folks, 80s, 90s, still wearing lipstick, still driving, right? And if you still, you're 90 years old and your family lived to be 100, guess what? You got some years left. So stay on
mm.
top of these things.
Wow. I'm sorry. I was like, what? I'm like, I think it's a lump, right? And then you say that, and I'm like, wow. Okay. Okay. It's powerful. Thank you both so much. I want to keep going. We're gonna have to do a part two.
Yeah.
There's so much I want to talk about. And I want to just appreciate, give both of you my flowers. I love you both. You are family to me. Thank you for your work, for being out here saving lives. Do you all want to, I would love to give you the floor for parting words before we wrap up today. Any last thoughts?
I would just say to Mia, listen to your body. As Dr. Gary said, sometimes there's no symptom at all, but it's so important that we just prioritize our health because everything else can wait. And so even now, October is almost over, but still continue every single month.
Hmm.
Check the girls, do your exam yourself just to make sure that there's nothing there. And live every moment. I always tell people since I was diagnosed with breast cancer, live every moment to the fullest because you never know when life will be snatched away from you. And so
Mm,
a lot of times we get caught up in these trivial moments in life, but it's so important that we say, you know what, every breath that I get is a gift. And so for those who are listening, go out there and live life to the fullest because you never know when it's going to be snatched away.
mm.
Ditto what she said. I just put my Instagram in the chat. Please feel free to follow me. Drop any questions. Um, I put Still Rise Farms Instagram in the chat. Reach
Okay,
out to
good.
us for questions, for comments, for booking retreats. In Pennsylvania, we have day retreats, and we can curate and facilitate the retreat that you choose. So you let us know the topics that you want to focus on, and we can provide those specialists for you, whether it's sound therapy, yoga, ecotherapy, nature walks, fishing, gardening. We will personally curate an experience for you. We make our own teas and we do tea making workshops. You can bring your executive teams out and have an executive retreat. We have a group of politicians coming out next Saturday who are doing their strategy
Yes.
retreat. And so, we welcome you all at Still Rise Farms. And please follow us for more stuff.
I can't believe that retreat is already next week. That came up quick.
It did.
All right. Well, thank you both so much. Hi, Mom. I realize I didn't shout you out. My mom does not miss a webinar.
Oh,
And this was amazing, and I'm glad it's recorded because I want to listen to it again. You both dropped some great gems for our folks, and for those that can't make it, we'll be making sure to send them out the recording. Thank you both so much, and y'all